very moment. And it looks like we have an 8th member in the queue too, Amy, if you want to add them in. I know we're live. So good afternoon, everybody. Sorry we're running just a little bit late, but I will go ahead and call to order this special session of the Auburn City Council and our Auburn Economic Recovery Workshop. So if you will all join me for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Again, good afternoon, everybody. As you have now probably gotten into the drill, this is a formal special session of the City Council, so I will ask the City Clerk to please take the roll.
Councilmember Dowden Calvillo.
I'm present.
Amara.
Present.
Mackey.
Here.
Looks like we're missing Councilmember Spokley and Mayor Berlant.
And I am here as well. Great, thank you very much. We'll move right into our agenda here, and our first item is public comment. Anybody who would like to speak on an item that is on this agenda may do so. As always, the last couple of months, as it was posted, we've been accepting public comment via voicemail as well as email. So I will first see if there's anybody from the City Council or our distinguished guests that would like to make a public comment this afternoon. Not seeing any. Amy, is there anybody from the public that has contacted us?
There's no public comment for this meeting.
Okay, great. Then let's just jump right into it. So the first item on here is our health and emergency response update. Myself and our city manager met this afternoon with the Health and Human Services Director, as well as some other leaders in Placer County. Just a quick little statistical update. We're now up to just under 1,900 positive cases, 61 people in the hospital, 14 in the ICU. And if it's important, which it is for many people, 27 of that 61 are Placer County residents, and 5 out of the 14 in the ICU are Placer County residents. So about 50%, give or take, are Placer County residents within our hospital and our hospital capacity. Right now, we're averaging about 40 new cases a day. And something that's changed since last week, if you haven't gone to the county's website, they are in their dashboard, they are showing the new cases and displaying it a little differently. So they're really going back and figuring out what was the day the patient was infected, not just the day that their test results came in. And so what happens is they may get, I think even today, there's like 60 new cases today. However, those 60 cases are not displayed on the date of July 31st, today's date. They get spread around to the date of infection. And so that's a little bit of a change. It's a couple things, reasons for doing that, but one is it doesn't necessarily show this big up and down spike. That's not really realistic and timely. It kind of puts it back into more of an appropriate time period of when those occurred. But again, averaging about 40 new cases a day. And 40 is important because the goal for our county really needs to get to the part where we're seeing 28 or below new cases a day. Well, obviously the goal is to get to 0, but in order for us to get off of the state's monitoring list, we really need to be able to reduce our infection rate to under 28 new cases a day. We are still on the state's monitoring list for 2 indicators. However, as I mentioned last week too, the state is behind in some of their statistics. So really we are on there for 3 indicators. The state just hasn't caught up with capturing that. But those 3 indicators include ICU capacity. We're required to have 20% ICU capacity available. We're at 11%. Our case rate needs to be under 100 per 100,000. And while another state difference, the state has us at 104. The county's numbers are closer to about 120. And one of the reasons, real quick for everybody, why the state doesn't show what the county shows is it's just a lag time in delays in how they do their reporting. So the counties are obviously more realistic or more accurate, I should say, and up to date. then the third threshold that is not displayed by the state, however, it would put us on the list, and what will right now would keep us on the list is our 7-day test positivity rate, which is raised to 8.7%. The state threshold is 8%. Again, if you go to the state's website, they don't show that. However, that is, we do meet one of those thresholds. So again, meeting 3 indicators that keep us on the monitoring list. Sorry, let me just catch up my space here. Yeah, go ahead, Cheryl.
So if we go below those thresholds, whatever they may be, how long does it take for us to get back open again? Do they make us wait another 2 weeks?
Yeah, so we need to be off the list for 3 days in a row, and then 14 days later, and I don't know if that 14 days is after day 3 or if it's after day 1 of us getting off the list, there's an additional 14 days.
So one other question, I'm sorry.
That's okay.
How long is testing taking?
So testing, they said, continues to be a challenge. However, the average testing appointments has come down just a teeny bit. Instead of it taking 7 days to get an appointment, it takes 5 days. So we're still in that same discussion point as we were last week, that the amount of time it takes to get an appointment and to get a result, typically speaking, because you can go into your doctor's office or even the hospital and they can do it almost immediately. But if you go to a county facility, one of the free locations, it takes almost 10 to 14 days, which makes the testing almost a moot point, because by that point, even if you were positive at the time that you took the test, most likely you would have had recovered or at least no longer been contagious.
Well, just for example, I got a test on Tuesday, my first COVID test, because I had a minor medical procedure on Thursday, and they had the results back by the next morning. I went in at 8:30 and they had the test back by 8:30 the next morning. And by the way, I'm negative. I just want everybody to know, so stay for a little while.
Congratulations
All right,
on that. Thank you
Cheryl.
for sharing.
Put yourself in a bubble, Cheryl.
Yeah, exactly.
But yes, as I said, you can go to your medical provider and even the hospital. The hospital can actually do the test that takes 45 minutes. It is the free testing provided by the OptiServe, which is their contractor, the Rockland location and the Kings Beach location. That's where it takes almost 2 weeks to do. And the county last week, we had a lot of discussion on it, agrees that it's unacceptable, and they're continuing to try to find ways to balance that. But it's a statewide contract that and I mentioned this in I think a couple weeks ago. The problem really comes down to they funnel all of their tests to one laboratory down in Southern California, and so it bottlenecks there. In addition, one of the other issues though that is causing a problem here is in Rockland. They have a significant number of no-shows. So people who make appointments and then don't show up. And so that eats away at some of the capacity that could be available as well. And so they're working on some ways to try to help fix that. Last week, they had come out with, they were changing the testing criteria so that only those that are asymptomatic or prioritized at risk, et cetera, would get the front of the line testing by those OptiServe locations. However, so far those locations are not using the county's prioritized guidelines. So really still anybody who wants can still sign up. And again, the problem here in the South Placer portion is that there's just a lot of people who make appointments and then don't show up. And then that just compounds the problem.
Hey.
So yeah, go ahead, Allison.
Have to unmute myself. I wanted to kind of get a little clarification on something that Cheryl had asked about. And it was, after we're off the watch list and it's the 14-day period, can we reopen? And when I was talking to Dr. Sisson yesterday, she made it clear that after we're off the watch list, that doesn't necessarily mean that our businesses can reopen. If the businesses that were closed, as far as I understand it, and correct me if you heard it differently, Daniel, but the businesses that were closed or are required to operate differently because we were on the watch list will still be required to operate in that same manner. Really what will be affected if we get off the watch list is the ability to have the kids go back to school.
That's right, I think. Allison.
Yeah.
Okay.
If you remember, once we got on the monitoring list, there were a number of sectors, including restaurants and bars, that then went on the statewide closure list. And so it was no longer just those on the monitoring list. There are, I think, though, additional sectors that are smaller and probably not as, I don't want to say more as important, but I think your point is accurate that indoor dining is not going to be necessarily turned back on after those 14s. However, and Bob may be able to jump in here too if he heard differently. What we heard today, though, is that the state is continuing to analyze the guidances that they have. And so there may be some modifications to the current restrictions. Now, that could be relieving some restrictions. And I didn't get the feeling that there was more. Specifically, what was mentioned was there was a rumor that indoor dining was actually going to be taken off of the list and allowed back with some additional guidance. And so the county went back to the state yesterday and asked for clarification. So I think the point is that it's likely a day-by-day here decision by the state that they may tweak some of those restrictions. Bob, is there anything you want to add to what we heard today as far as the additional guidances that may come out unrelated to schools and youth sports, which I'll get into here in a second, but at least for those sectors that were closed when we went to the monitoring list?
I think you hit the main points. There's the clear frustration with the medical staff at the county as well as throughout the state. There's constantly conflicting information that's coming forward. And so it doesn't seem as though, even at the state level, that we have any clear consistency of data or opinions as to how to continue to approach these things. So yeah, I can easily see that we'll see changes in responses to whatever our numbers are.
Well, and so Allison, to take your question though, or your comment about except for schools, they let us know today the state is actually coming out with some additional guidance that will actually likely provide for a waiver process for elementary schools to potentially actually open up earlier.
I can speak to that, Daniel, when you're ready.
Yeah, no, why don't you go ahead?
Yeah, so, and we just had a school board meeting last night, actually. And, you know, they are apparently coming out with that extra guidance, but one of the difficulties is there's still the mandate that the staff be tested on a rotating basis. And there's a conflict right now because we're also being told you don't test unless you have symptoms, and there's not enough testing. So even if they come out with this extra criteria for the waiver, they still have to get over that hurdle on the testing piece. So schools are still grappling with that. So, you know, and I honestly feel that, you know, schools at this point in Placer County are going to open virtually. Most of them are going to be opening in the next couple weeks. And then it's just going to be a matter of when they go into in-person. For, you know, for our district, we're going to actually revisit it in September at our board meeting. And so we're letting our parents know it's going to be at least until then that they'll be doing their distance learning so that they can have a little bit of stability. But it's all over. It's very difficult with the schools right now because, you know, until today's announcement about additional guidance, there was no guidance for the waivers. And, you know, so, you know, again, they went up a little bit with that, but yeah, I don't see schools opening for a while.
And here's the other part, you know, this decision about providing the waiver for elementary schools, which was defined as schools that are K through 6, is that studies have shown that younger children are less likely to be infected and less likely to spread. However, our Human Health and Human Services Director noted that in today's media, there is a new study that came out that actually disputed that and said the opposite. And so I think one of the challenges, and I mean, challenges we've had from the beginning of some of these, you know, back and forth is that there's competing studies, there's competing misinformation. And so, you know, we just got to wait and see it, you know, and believe it when it happens. But they are working very closely, as Alice knows, with her school district, working very closely with the school superintendents to bring, you know, provide information as quickly as possible. I guess for the rest of us and for the general public is stand by because there's likely going to be changes from what has been originally said. But I think the comment is dead on that the beginning of this school year in Placer County will likely start virtually for every school district.
Yep.
Youth sports has obviously continued to be a hot topic. The county is expecting additional guidance to be released on youth sports. And what they think it will include is likely continuing to allow or clarifying to allow conditioning as well as contactless sports. And so maybe there will be allowance of some sports, just those that are don't have contact amongst the players. And this guidance would be for school sports as well as club sports and even higher education college sports as well. So there has been some differences over the last couple of months, as maybe Rob and some others know, between what the state has been saying and what the county was saying, and then the county kind of changed back on what's considered conditioning. But, state guidance is likely to come out related to youth sports. So again, that's another area we'll need to continue to watch. The last thing I just wanted to mention here is congregate living continues really to be the location where we see a high number of the new cases coming out of. And those are related to skilled nursing facilities and assisted living facilities. And so the county's working and has been for many months now, but to continue to provide support and assistance to those locations. If I have my numbers right, and Bob, you can correct me if I'm wrong, 7 out of the 10 facilities across Placer County have active COVID cases and issues. However, the little bit of good news in all this is the state who regulates these facilities, they're not regulated at the county level, they're regulated by the state of California, is considering changing some of their guidance for these locations, specifically related to visitation, and acknowledging that the isolation of our senior citizens in these places, especially those that may be nearing the end of their life, need contact with their family. So how do you balance the concerns and the depression caused by isolation with the potential spread from the outside when you allow visitation? But likely there could be some guidance on allowing visitation at these congregate living facilities. And then a little bit later here, when we get into some of the other items, I can briefly mention the grant program. Allison or Jack, you may have more as well, but just for the group, next Friday, even though I'm hoping we don't have any major difference in news by that week, but I still want to meet next week because we will have representatives from the county to talk about the Placer Shares program and what it is. So I'll dive into that in a little bit later when we get into some of the recovery items. So with that, that's kind of the update on the health and emergency response. Bob, was there anything that I missed from today that you might want to add?
No, I think that was pretty comprehensive.
Great. Any questions? Yeah, Rob, go ahead.
One from real early, you mentioned that we're trying to get the rate down to 28 cases. And is that to get us under the 100 for 100,000? Because if so, we're about 400,000, almost exactly. We're like 398. So theoretically, 38 cases a day average would get us under that threshold. Is there some other piece of that I'm not understanding?
Bob, did you take away any clarification? Was that related to, Rob, I don't know the answer to that, but Bob, was that related to the 7-day test positivity rate?
That could have been. Yeah, that
Yeah.
makes sense.
Yes. Because
And I didn't,
you're
Rob,
looking
you
at
could
different
completely be, sorry, Bob, I talked over you.
I'm sorry. It's just you're looking at different metrics here, and there is the rate of per 100,000, and then there is the how many new cases every 7 days. And there's
Wow.
several other metrics, like we talked about the hospital bed metric. It really doesn't mean how many physical beds you have. It is really a metric of not just a bed, but the equipment that goes along with it and the staffing that goes along with it. We call it the bed, but in reality, there's a whole series of metrics that go into that. So sometimes the simplicity of looking at this stuff gets us confused.
And that's, as far as ICU beds, that's the 100, roughly 140, our baseline. And it was a question I had about whether we could fix that or get off the list if we ramped up a little, like in our attestation, right? We talked about, a ramp up process for the hospitals, but I haven't heard anybody talk about whether that's even.
So Bob can tell you last week that was a major spur in my heel with the county, the fact that the baseline hospital beds and the surge capacity is almost twice the amount that's currently being used. In fact, when we started this whole process, and I think it's in the attestation memo, but the hospitals built capacity for almost 1,000 beds, yet the latest figure was that there was only 407 staffed beds. And what it really came down to was that, as Bob mentioned, the equipment and then being staffed. And so my question really was, well, when will we go to surge? When will we start using all this capacity that we built? And the answer is the hospitals will go to surge when the hospitals go to surge. And my kind of pushback on that was, that sounds great, except we're keeping restaurants closed because there's not enough hospital beds, yet we have no real metric or say in the science and the decision for hospitals to staff up. And my understanding from those in the healthcare world, hospitals as a business model like to run at about 80% usage, meaning that they are always only staffing to about 80%. That's where they, otherwise they're going to lose money. And so they're not staffing to 100% of their capacity. They're staffing at this 80% average level. And so there's a lot of factors then that are really in the decision making of our hospitals, which by the way are regional, and that's how they were built. And so the usage of them too doesn't necessarily match up with the need of Placer County. So it's a long way around of saying, I think there's there's a systematic issue with using that as a threshold. I think the county would agree, and has the way I at least took it was that they agreed, and we're trying to help see if the state would change the metric a bit.
I mean, basically saying hospital profit margins matter more than the rest of our businesses, and that doesn't feel like they're a team player. I mean,
and I don't want to be the one to say that, but that's what it infers.
Mhm.
And Daniel, have we heard, are the hospitals stopping elective surgeries? Because I think that's part of, from what I understand from my daughter who's in the healthcare, is that they're still doing the surgeries. And so that's taken up a lot of the beds. And to make your point, I agree with what you said, and it takes a long time to get the nurses trained and all that. So it's staffing is a real issue.
Well,
But yeah, I wasn't sure about the elective part.
Yeah, I mean, I think the answer has to be yes, and then you add, typical other health conditions and traumatic events. But just statistically looking at it, a couple weeks ago, the hospitals were staffing at a baseline now of about 400 beds, give or take, and it probably changes daily. And 61 of those beds are being used today by COVID patients. So you can see that just out of the staffed beds, it's, what's that math? Less than, 20%, maybe even 15% are COVID. And so I don't know that answer. And just to make sure everybody's clear, this is not a dig on our healthcare workers who are working their butts off, long shifts to keep people, to care for them. But it just goes to the discussion of when we talk really about these restrictions and these closures being science-based, at least the ICU capacity component is not necessarily a science-based decision. It's really a business model decision. Any other questions on the health update?
Thank you, Daniel.
Okay, then let's move on to city actions and services. Bob, what's the latest in the city?
Well, the club car says they're going to be opening it up hopefully this weekend. So they'll be moving out to the sidewalk and into the adjacent parking areas as well. The mayor and April Maynard have taken the lead on creating the designated barriers and really a lot of the decorative portions of those barriers. City staff brought in a lot more material today. So I think you two will probably be busy at work tomorrow in the
Me
down.
too. I'll be out there. too.
Alice is going to join us, and probably anybody who wants to come help schlep some plants around, can do so.
Very good. We have completed our guidelines for allowing yoga and Pilates in the school park preserve through September. We went back and forth on the structure of it several times. As it turns out, ARD is not going to be providing those services. When they told the different businesses what the cost would be, they pretty much backed out. I think from my perspective, there's always that balance of, do you allow a for-profit type entity to utilize something for a fee or for free? I think what we're doing that now with restaurants.
Mhm.
This is an unusual situation, and I think I'm very comfortable allowing a structured use of the park preserve for yoga and Pilates classes on Mondays, Wednesdays, and Fridays starting at 7 a.m. Something they can all sign up for. 1 hour classes. There'll be an hour and a half in between classes, or extra 30-minute increment between classes. And they'll be allowed to do this free of charge until the end of September. And that program would then go away or can be reassessed by the administration at that time.
I just want to say, I really appreciate that, Bob, that we're not charging, because I think it's ridiculous that ARD is charging during these times when there really isn't any cost to them. A little bit, maybe admin, but not a lot. So I'm grateful that we're doing this. And, we have the Monday, Wednesday, Friday. I'm hopeful that maybe there might be another studio that would like to utilize the park preserve, maybe on Tuesdays, Thursdays, Sundays, or what have you. But anything that we can do to help those other businesses, we're doing so much with restaurants, which I applaud, but anybody, that needs that assistance. So thank you very much for taking that approach. To me, that's really very important. And I'm very sorry to hear that ARD is not taking that same approach. So thank you.
And if I could just jump in, Bob, as well, and this may have predated Bob's return, but the city council at the time, we had a request to use one of our public parks for dining. And at the time, myself and the council as a whole came back and said that it wasn't a fair and open process. But I think that the emergency that we are under right now and the crisis to our economy, that we need to be doing everything we can to utilize this open space, this underutilized space, to support our businesses. And I think the guidelines that have been built to make sure that it's an open process and that it's not just, who knows who, or in the case of the Pilates, who runs into who walking through the Old Town streets. It really is open to anybody who needs this flexibility. So I too appreciate it. But I do want to clarify that, because I have been on the record to saying that, one business should not profit on using public land. However, we're in a different scenario, and we're still making sure that we are balancing that for all of our businesses, not just, one or two or first come, first serve. So
Absolutely. We're in a completely different place right now. And I agree, Daniel. I remember that actually came before the Planning Commission too. And we all were on the same page as planning commissioners and city council, but we're in a completely different time now. And whatever we can do, fairly to help our businesses, then, we need to do it. So thank you.
On Monday, we'll be finalizing the locations for the hand sanitizing stations that will be paid for by PCWA. The same day, we'll be submitting our requisition to them and hopefully have those up and going. We'll be placing them on sidewalks in areas adjacent to outdoor dining opportunities. That's their preference. It makes complete sense, and we'll get that done. Today, we had PPE distribution day. Amy was downstairs handling that. Hope it all went well. We did receive another pallet and a half or so of masks. So we are well stocked, continue to be. Thank you to the county for handling those. The Placer Shares program, we have already provided the county with the data that they're looking for to assist them in distribution of information to to businesses. So I know they'll be reaching out and handling a great deal of that later in the month as that program opens up. We'll also be receiving a report later this week, this following week from the SBA. It will be a report of loans that have been issued to local Auburn businesses. We can see really for the first half of the year, the extent that these programs are utilized by how many businesses and to a dollar amount. It's also of note to bring up that the number of complaints that we're starting to receive from the community about businesses are certainly going up. This is just one page of several that I've received today. These are the complaints that come through the county and then via or email to me. A lot of them are businesses that we've already spoken with. And so it is something we just need to continue with the education process. And hopefully people start to get the idea, business owners will start to get the idea, if you're not working with the guidelines, that there are a lot of people looking at you and a lot of people really not wanting to come into your business or to patronize you. So we will continue to get that message out to folks and make sure that they know what are the standards that they should be adhering to.
And Bob, with
yeah.
that, I know we're taking an education approach. So I think it is important for the businesses that are in the city that may not be in compliance. It just may be that they get then 2 or 3 visits because you are looking, you're following up on those complaints. And so, that might also help to encourage them, seeing you again. But, people are complaining and I think that might be a good route to take as well.
Will do.
And always taking those masks. If you don't have them here. No. Sometimes you have to go somewhere 3 times, so.
Absolutely. And in fact, the one business that you had received concern about is on today's list, continues to be. So point well taken.
Bob,
Mr. Mayor, that's all I have. Happy to answer any questions.
Go ahead, Cheryl.
so do we have an ability to take away their business license? We
I
don't.
think your most fundamental route would be a process of fines. And you could certainly do that. You could put those in place very quickly. The mayor and I have had that discussion actually this week. What are the kinds of options that the city council could have available to them? Really with the business license itself, it doesn't come conditioned with you must do X, Y, and Z with COVID. However, we do have the ability to issue citations and fines as you see fit. And so that is an option you certainly can address. And I would, as I told the mayor, I think it would take us about 48 hours to have a program in place.
Would that require city council adoption though? Or is that, I would like to be able to have that discussion before we went that route.
That absolutely would.
And that was our discussion, was that it wasn't staff or myself's recommendation to move forward with that. And that if the council others wanted to have that, that could be requested by them. But that at this point, that was not something we were moving forward for discussion or for action. But if 2 others want to, that obviously is within the council's purview. But at this point, when Bob and I spoke, neither of us thought we should move forward with even having that discussion. We should stick with our education and some more of that, as Bob, I think, alluded to, kind of peer pressure from consumers.
I guess my concern would be how much staff time is spent on going back and forth to these businesses. And at some point, it becomes costly even for the city to be doing this. I guess it would be interesting to know how many times you go back and forth to particular places and the time you have to spend doing that.
It hasn't been onerous by any means, and I've been sharing the duties with the police chief. Seeing one or the other of us, we thought would have a little bit better impact. However, with the numbers that I'm starting to receive as far as complaints this week, if that stays status quo, yes, I think your point is very well taken. Now it's going to become an issue of workload.
Yeah, go ahead, Ron.
Yeah, just, I'll tell you something to consider, and obviously I'm not on the council, but the notion that that is a potential stick, being, I don't know if businesses even realize that that's a potential outcome. I know they're doing it in Roseville. But, it might be that just people starting to realize that that could happen could be enough to curve that behavior a little bit. I mean, it's one thing when you're showing up, Bob, and saying, hey, man, put a mask on. You guys are killing me. And you do it 2 or 3 times. At some point, right? Like, you got to be, they're going to look at you and say, well, what are you going to do about it really? So maybe having that just out there. I mean, I don't know that people realize that you're, as a jurisdiction, you could do that if the council so desired.
Maybe we could take a quick opportunity and open up to the chamber and the business, well, at least Old Town Business Association. Is that, what does the business community think of that potential?
I haven't really heard anything from anyone as far as being worried about it. But I also was thinking if maybe you had I know there's a lot of volunteer police officers. I don't know what exactly their job is, but maybe if they went in and talked to them, at least it's someone in uniform. Maybe if that would have more effect than just a city employee or Bob doing it. I don't know.
No, thanks,
Well, they
Jackie.
have sent officers.
It was.
They have sent officers,
Oh, okay.
regular officers. And to Sandy's point, that's very expensive.
Yeah.
Well,
And
and based on our,
according to the League of California Cities, there's a lot of cities that have put fines in place for businesses, up to and including $1,000 for
I know-
the second or
I
third.
know there was something going on in Nevada County about that. It was started at 25 and doubled every day.
Mhm.
But I know that they halted that due to some signatures collected.
Mhm.
Those were restaurants too, I think specifically in Nevada City or Nevada County. I've heard complaints from people, not business owners. So I've heard complaints from customers and clients of businesses that are not using masks or are still allowing indoor dining. I know of at least one place that's still allowing indoor dining in our county. I don't think it's in the city. And I have heard complaints from people who realized that was happening and chose not to utilize those businesses. So what we've always been saying is the best marketing that a business can do is make sure that they instill confidence in their clients or customers that they are being safe and that those people who are their patrons will be safe when they come in and that they're utilizing masks and hand sanitizer and washing and social distancing. So that's all I've heard about. I've heard more from patrons than I have business owners with regard to this. And I've heard quite a few people choose not to utilize a business because of their lack of masks or social distancing.
appreciate that. Nina, any thoughts from Old Town?
I struggle with the idea of fining or pulling any type of licensing. I mean, businesses are struggling so hard. I think it just falls down to, maybe reminding people, but also I have seen that most people won't patronize a place. And so that kind of falls on them too. I just think in this really tough economic time, people are struggling. We have businesses shutting and then you're going to throw fines on them. And I don't think that's correct. I also don't think it's just good for relations with the city and the businesses. I mean, I think just again, reminders and encouragement. And I have seen that most people won't patronize a place. And so they're going to have to do it on their own.
No, appreciate that. No, valid points from everybody. And I guess I'll just leave this item for the city council members. If there are members that do want to have this discussion and see what, take this a little step further and see what a fine schedule could look like, please let Bob or myself know, and staff can work on that. But again, at this point, that the education process is the direction staff are recommending. Bob, any other updates from the city?
I think that does it.
Okay, great. You kind of captured on a couple items, so just want to make sure from the group, anything else anybody has related to outdoor dining or even usage of public space? Yeah, Alice, go ahead.
Just a really quick question. Bob, how about the Royal Indian Cuisine? I know they were looking to go outside in the parking lot too. They were kind of working in conjunction with a club car, and it sounds like club car is moving forward. Just was kind of wondering where they're at in the process.
The last communication we had this week was that they were not going to reopen outside.
Okay. Okay. Thank you.
Anybody have anything else on either of those two items, outdoor dining or the public space? Well, I'll just close here on this item. I really did appreciate seeing both the fairgrounds this week, as well as the School Park Preserve, being a location for yoga and for Pilates. And to me, seemed like a great locations, both of those, for that type of activity, despite the fact that, they're doing it because they can't be indoors. It just seemed very relaxing, and it was just a good way to take advantage of the beautiful scenery that Auburn provides, and the trees and the shade. So if you have, I tried to, not look too long, but I enjoyed at least, allowing them to have that opportunity. Okay, let's move on.
We'll go take yoga together next
Okay.
week. We'll go to the
I did
park.
see there were at the Pilates in the School Park Reserve, there were several males, and with my neck hurting last night, I said, well, maybe that would relax me from the stress of these days. So thank you. Go ahead, Rob.
And I want to say one thing on that note. One of the things that we're trying to do in terms of our promotional work is we're really we're walking away for the short term from like promoting our trails and stuff. I mean, everybody knows where they're there. They're all there. And so we're really pivoting and trying to really promote our businesses, especially ones that are being creative with how they're dealing. A good example is Tre Pazzi and the alleyway. It almost looks very European-y over there. And I think that, that's an awesome thing. So in terms of some of these classes, these outdoor classes, if you know owners and you have them, and if people could take some photos and get them up on their Instagram, tag us, these are the kinds of things that we really want to be able, to showcase, of what our businesses are doing. And then the travelers that are already here, we want to make sure they know, where where they can go dine and do different things like that. So just really want to encourage people to be good about, to really be proactive about promoting these creative solutions, because definitely what we want to be focusing on in the near term. So just want to throw.
I was
Yeah,
just going to
appreciate that. Go
mention,
ahead, Alice.
Rob, that there is a group I've seen on Facebook that are really adamant about wanting to close our access to trails, period. So I don't know if you're feeling that, but I'm seeing a lot of drama, because of what happened up at Yankee Jim's.
Yeah.
And so it's an interesting, it's interesting. We haven't had the kinds of trash and garbage in our trails. As someone who just was out running this morning in the canyon, I don't really notice any more garbage than usual. And it's hot, so you don't have as many people. Although this morning we did have more than another day this week.
Yep.
But I don't know if you've heard a lot of that too, where people are just really encouraging flat out stop, which for us would be, very difficult, because you've got a lot of public access to our system. Folsom Lake State Recreation Area does not have that. They have specific points or private property. Here we have PCWA. There's so many different opportunities. So, but I just wondered if you were seeing that pressure too.
Absolutely, Alice. I mean, it's, you are seeing the pressure everywhere, right? Like, I think you guys know Dan Looper. He was just up at, if you know where Emerald pools are. That's not our county, but it's kind of a hidden gemmy. And you saw what he wrote. He went up there last week and it was 94 cars, which is unbelievable for that spot. So I'm sympathetic to people that are worried about it, but there's also the fact of the matter is we know that outdoor activity is the safest thing you can do. There's nothing else for people to do. So I'm super defensive about allowing it personally, but we see it on our social feeds. People would be like, stop promoting us, like there's too many already. And I get that and I'm sensitive to it. But the fact is people are coming. I think they need to come. I think people need for their mental health to come. But what our organization is really going to focus on is to not be like, hey, we changed some of our language because as we had said for a while, we had a tagline where we said, as we welcome you responsibly to our county. And now we've kind of taken some of that, like that seems to be a point of contention, right? Like, why are you welcoming people? So we've kind of tweaked that language to be more about like, as you explore, because you are, come, here's our eateries, here's the cool place to, because the reality is it's real. People are mad. I mean, 67% of Americans right now, and again, as you know, we're on these calls all the time. 67% of Americans do not want anyone coming to their community, So that's where, Bob, you're dealing with all these complaints about, people are, they're this, you hear this talk about the loud majority or the loud minority, the silent majority. Most people are still afraid, and that the large majority in every area of this country, so being as responsible as we can is by far the best. So absolutely, Alice, we're seeing it. We're trying to tweak our messaging, and but yeah, it's a very thin line you walk right now as you try to keep your businesses afloat and keep very nervous residents happy, for lack of
That's what I was saying. We should have this little signs when people do go and go on the trail, go have a sandwich,
Right.
downtown or, but it's a fine line. And I appreciate that you're getting that pressure too. So, cause I do see it and, thank you.
Yeah.
It's interesting, Rob, you mentioned that a local television station here in Sacramento today actually did their first piece that's, I think they're calling it On the Road, and they're highlighting kind of more or less secret trails, if you will. And so the reporter had messaged me earlier in the week saying, hey, can you tell me the good spots that are historical in Auburn? And I've struggled providing anything to them. Which is not usually, I got a handful of ideas right off the bat to get, some coverage, but, it's a hard balance. And, I drive through Old Town though, and I see that those people that are driving up to these locations do stop at our businesses. And, we do see the positive impact from them financially, but at the same time, you drive through the canyon or any of the local trails and, Yankee Gyms, I was down there 3 months ago at the beginning of the shutdown, and there was 3 cars on a weekend. And now you see the thing about 300, it just blows my mind. And the sheriff has had continuous problems with trespassers on the Forest Hill Bridge, on the catwalk underneath. And so it is a balance. So Rob, I appreciate your efforts and thoughts here on this.
Well, and then there's people that at this point, it's a $75 fine and people are just willing to pay it. There's 12 spots down there and they gave 100 tickets or 112 tickets. And to the point about hidden gems, that was something we tried and got pushed back on pretty hard by some commentary. So we posted a picture of Sugar Pine up in Forest Hill because it is kind of a hidden gemmy, and Forest Hill is really, and the feedback was pretty immediate. The folks in Forest Hill, they're not shy where they're coming down, and so that was probably one of our more divisive posts, and kind of really got us thinking about what we should be doing as a tourism promotion organization. So
Yeah.
Fine line, fine line.
it is.
The last thing that I just wanted to mention here under this topic, and we briefly discussed it last week, but the Placer Shares program. So I did send out to this group some information that was provided by the Board of Supervisors. And I did have a conversation yesterday with the county's economic development director, and she will be joining us next Friday to go into more detail. But just for everybody's awareness, the Placer Shares program is a program developed by the county using 20% of their CARES dollars that they're receiving from the federal government via the state. They set aside $8 million, 7 of which for businesses, 1 million of it for nonprofits. And these dollars will go to support businesses and to nonprofits. That they have a list of criteria, and I'll just really quick go through the initial list just to kind of give you an idea of what it is they're looking for through this money. They're looking for businesses and nonprofits that have had a loss of personnel, have had a loss of fundraising or revenue, that have had additional expenditures to meet the growing community demand as a result of COVID, additional expenditures to change their business operations, i.e. maybe indoor and outdoor, loss or diminished offerings for specific programs, estimated loss of volunteer hours, and the disclosure of any other, well, that's just another requirement. So this $8 million will be available starting August 25th is when the grant program opens up. Depending on the size of the business or the organization, there's up to $10,000 available for each business. So again, I did send to all of you just kind of the summarized plan by the Sierra Business Council, who is going to be administering on behalf of the county. Like I said, we will be having Sherry Conway with us next week. She was not able to join us this week, but she will be joining next week to dive into a little bit more of their intent, their plan, the process, and then to answer any specific questions related to that grant program. So hopefully, I know that, Jackie, I think some of the county staff had reached out to the chamber to get a little bit of information. As Bob mentioned, city staff have helped provide it. And so all that kind of helped create the parameters for the grant program. But Sherry will be here to answer any specific questions, because I think there's some good opportunity. While in the big scheme of things, $8 million for an entire county of businesses and nonprofits is not a lot, but we definitely want to do everything we can to make our businesses and nonprofits successful in applying for and then getting awarded some of this money. So I don't have much more than that, but if anybody else has anything additional they want to add or questions, let me know. Okay, so we'll dive more into that next week. The next item on here is the business personnel protective equipment. Bob had mentioned receiving another large shipment of masks, as well as sounds like Amy and city staff spent the day issuing out PPE. Jackie, Allison, anything new from the chamber related to this process?
No, I'm still trying to work with the county to get the word out to the Auburn area, more than just the city. I'm going to work pretty hard on that next week and go through the emails I have and try and get that out there.
Okay. Anybody have any questions for Jackie or for our city staff on the PPE? Okay. Next on here then is our report from the Auburn Chamber of Commerce. Allison, Jackie, why don't you take it away?
Thanks, Allison. We actually are just put in a new process for a pay it forward program, where we found the need for people that wanted to continue their chamber membership but couldn't afford it. And we also found businesses that wanted to help other businesses because they realize how strong the chamber is for business. So we've now have on our website where you can either be a recipient of a pay it forward or a donator of a pay it forward and pay someone's membership for the year that hasn't been able to afford it during these times. So we're pretty excited about that, not only to continue to help our members and help the members that really truly need us, but allow for businesses that are doing well in times like this to support the community as well.
Great, thank you. Allison, anything else to add?
Yeah, we have one other program that we just rolled out as well, and it's pretty straightforward. One local business a day. And so we've been challenging everyone in our community to just support one local business each day. And that doesn't necessarily mean that you have to go out and purchase a product. You could help them by advertising for them, by sharing one of their social media posts, responding to something on Chit Chat and recommending a local business as opposed to an out-of-town business, or just telling your friends and family about one of your favorite businesses in our local community. And it's starting to gain some traction. I'm seeing a lot more posts on Facebook, and we actually do have a graphic that you can use if you are so inclined to post about a local business each day. You can grab it from our chamber page. Feel free to share your post about how you're supporting a local business every single day and use our graphic and encourage other people to do it. I've had personally on my own page a lot of people that I haven't connected with in a really long time write a comment on some of my one business a day posts and say, hey, I didn't even know that business existed, so I'm going to go and grab a sandwich from there, or go get a service or a product. So I encourage everyone to do that. I think it's gaining a lot of traction, and I've heard a lot of really good feedback from local business owners that it's assisting them in getting people in the door. And
Wow,
thank you, Daniel. I noticed you've been doing it, and Alice, you've been doing it as well. And of course, Jackie, so thank you guys for participating.
Well, I was going to say, it's not just gaining attention. I think I gained some pounds last week in the amount of takeout that I did, and even delicious milkshakes in going around. I mean, obviously, I could have supported non-restaurant businesses, but that's not really the discussion. But, definitely, it's a great campaign. Appreciate you and Jackie kind of kicking this off a couple of weeks ago, and definitely has picked up some steam. And what an easy way for people just to highlight some of our local businesses as well, and to remind them to think Auburn first and shop local. So
yeah,
great, thank you.
Yoga, Daniel.
Yes, I just got to find time to fit that in. Anyways,
You could do it
thank you.
walking around the farmer's market.
Yes, Jackie can attest. That is a Thursday favorite for us as well. But as I told my wife, we have enough dang peaches that we purchase at both farmers markets. Yeah, lots of good ways for all of us to get out there and support our struggling businesses. So thank you, guys. We'll move on to business association reports. And Nina, we have you from Old Town. How are things going in Old Town?
Yeah, good. I was just down there actually this afternoon. People seem to be enjoying it and walking around. The restaurants seem to be doing okay. I was talking to people and they're getting people, and it's just been really nice out. Everybody's just working together. And then, as I stated, I think in the last one, on starting August 11th, and it'll go every other Thursday. For August and September, we're going to utilize our big parking lot and decks for nonprofits. So you're going to see the Nosh for nonprofits come out, and it's $25 a person. You can drive by either the front of the building, pick up, or come down, sit down, enjoy some music, some safe distancing, and pick up a to-go meal and sit and eat. The first nonprofit benefit on the 11th will be the senior center. Then I believe I think the next date's the 24th, whatever that other Thursday is. That'll go to Healing Hands Pastures, the horse therapy program. And then Young Life will be in September. So I'll get the schedule for you guys.
That's great. Thank you, Nina, for that, and look forward to that. And what a great use of the new space you guys have developed and constructed. And so looking forward to that for sure. Any questions anybody have for Nina and Old Town? Great. Thanks, Nina. We'll look forward to a little less than 2 weeks being out there. So,
okay, great.
Moving on, we'll do a quick round robin and just go to the order. If there's anything anybody has here before we wrap this week up. Okay, not seeing anything. Again, we will plan to get back together next week on Friday and can have some broader discussions related to the Placer Shares program and answer all the questions on that grant program. So with that, if you haven't already, you can go purchase your tickets for this weekend and Fast Fridays, starting in a little bit, the drive-in Fast Fridays, and then this weekend's drive-in concert and drive-in movies. And I know Jackie and the fairgrounds have been spending a lot of time to really put together a good fundraising event that's a good entertainment. And also just hearing Jackie speak on Tuesday at Medlar's, answering some questions and some concerns about all the steps and foresight that the folks out there have put to making sure people are safe, and that this isn't necessarily a public gathering, but to keep people safe within their own cars at all times. So Jackie, anything you want to add real quick to this weekend's events at the fairgrounds?
If you can come. It's a Save the Fairgrounds weekend. We're really trying to save the fairgrounds at this point, without any rentals or any income and without fair. It's not looking good for the fairgrounds, and fairgrounds is very, very important to our community. So we need to keep it as long as we can. And then actually the movies on Sunday are by donation only. Although the ticket price does say $30, it's whatever you would like to donate. So we more than anything, we want to have people come out and enjoy something from their car and not have to be in their house. And it's going to be great. Like I said at Medlar's, I saw the map for all the parking. There's plenty of space and plenty of space in the concessions as well. So it's going to be a good event, and lots of hand sanitizer and washing stations. So it'll be good.
Yes.
Well, I did post the map too, if any of you want to see it. It looks like there's almost like 4 feet in between each car. And again, if you stay within your car, you easily have your social distancing requirements. So thank you, Jackie. So again, just a reminder, we'll see you back here August 7th at 2 p.m. and we'll continue those discussions. And everybody have a safe weekend and go support one local business today. Talk to you guys all later.
Thanks, everyone. Good night.
Thank you. Bye.
Goodbye.